we recognise that health and social care services have to change. Even though in Aberdeenshire we're relatively fit and healthy, we still rely a great deal on both of these services. We expect the number of older people and individuals who need support in terms of their social care and their health to increase. But our budgets and staffing numbers won't increase at the same rate, so we're moving forward with integration. We're much clearer now about what this will mean for residents, staff, and people who need health and social care. It's our intention that services will be available more locally. Staff from both sectors will work together as a single team, and everyone will make much better use of the facilities and support groups that are available. So, what does partners in health and social care mean to you?
When I was first diagnosed with serious breathing problems, emphysema, I was really afraid and searched for help and advice. My GP and hospital consultant told me about medicines and so on, but I didn't feel included in the decisions about my treatment. I just felt that the illness and the professionals were taking over my life. But now I'm working with them, I know a bit more and understand how to manage my own symptoms, so I feel like I'm in control.
My daughter and I used to do a lot together, mostly the things that aren't that much fun. I'd take her for endless appointments and sit in waiting rooms. Most mornings the minibus would pick her up and take her to the day centre, and if the centre was closed, I'd have to take a day off work. The people there were the only friends she had really, but two big things happened. Instead of going to the day centre, she goes with her support worker to her job at the garden centre. We're hoping that over the next few months she'll start to go on her own. And she goes to the jazzercise class with my neighbour's daughter. No one minds if she doesn't get the steps right. The fact that she has Down syndrome isn't what defines her nowadays. She's a friend, a colleague, someone you see in the local supermarket, just like anyone else. I love looking after my daughter, but now I've got time for me as well.
What does the best of health and care for everyone mean to you?
I try to keep as well as I can, walking wherever I can rather than taking the car, and watching my weight. When I get colds, coughs and the likes, I go to my local pharmacy. They're really good with advice and information. I don't need an appointment either. My mum and dad relied on the doctor much more than I do. Mind you, when I felt really stressed last year, really down, I did go to my GP. She said that exercise would do me more good than a course of pills, and so far it's working for me.
I am looking forward to a healthy and active retirement. Keeping well for me means keeping busy, so I'm going to be a volunteer. I used to be a nurse, so something like befriending might suit me, or I may decide to do something quite different, like helping someone tidy up their garden. It would be fun for me, and I'd be giving something back to the community. It's a win-win.
I don't manage nearly as well as I used to. So a couple of years ago I looked around to see what choices I've got for a more suitable house. It's the best move I ever made, and I'm sure it was a big factor in getting me home from hospital right after my operation. It's my decision and my life, and I'm going to be as well prepared as I can be. It's my responsibility, my future.
What does effective treatment and care mean to you?
I really like having the doctor, the occupational therapist and the social work people working as a team. It means I don't have to keep repeating my story every time. And when I fell last winter and thought I'd broken my arm, I didn't have to go into Aberdeen for an X-ray. I was taken to the local hospital and treated there. I was back safe in my own home the same day. I needed some help with washing and dressing for a few months, but because I was at home, the care manager could talk this through with my daughter and I. The home carer encouraged me to do as much as possible, and I got back to my old self sooner than I thought.
My GP practice wanted to get as many of his patients and staff involved in planning the service as he could. I'm no expert, but I said I'd go along to have my say. I found I knew more than I thought I did. I've got a better idea of how the local health service works, and this time I've had a chance to say how the appointment system could work better. I'm starting to feel like the health service belongs to me now.
When my gran had a stroke last year, she wasn't able to get up and down the stairs. She really didn't want to move house away from her family and friends, but something had to be done. The housing service arranged for a shower to be put in downstairs. All the services worked together, the occupational therapist, the application for a grant, the plumber, and the work got done. She's so relieved at being able to keep her independence.
the integration of health and social care is a great opportunity. It's a chance for us to involve people as partners in their own care, make better use of community resources, and to promote recovery and resilience through access to the right kind of support. Most of all, it is the perfect time to ensure that our health and social care services are fit for the future.
Please hang up and try again.